During labor, what are the precautions to be taken to have a healthy baby, even though we may be knowing that it may be a critical case or a normal?
I think it is very important to monitor a laboring woman, especially if she hasn't had adequate antenatal care. It's very important to look at the mother's and the baby's well-being during labor. That's why WHO has designed a partogram beautifully. But it's important that we use the partogram in every labor. It's very important to monitor the baby's heartbeat during labor, and birth attendants should be trained to recognize problems with the baby during labor. That will largely prevent the associated complications that can happen to the baby. In every center, in every laboring unit, there should be a neonatal resuscitation facility. So if the babies are not born in an optimal condition, we should be able to sort of give that adequate resuscitation during that golden minute properly. So we should all be trained for that. Every caregiver should be trained for that, and we should have skills and drills to practice such a care to be given. So it's important that training should become a big part of our medical care. I think it is important to recognize whether this lady is at risk or baby is at risk, whether this center is suitable for them to labor. So these three things have to be assessed. It should be ideally assessed during pregnancy itself. But if it has not been, at least on admission to a labor ward, I think it's important that we assess these situations, whether this baby can go through the stress of labor or not, and whether we will be able to pick up the stress that's going to go through during labor. Because it is, again, it's a hypoxia, that is less oxygenation, which is going to cause the brain damage and lead to cerebral palsy. So it's important to recognize these babies. On the whole, what I would like to say is, if we have to prevent cerebral palsy, the care should begin even before pregnancy. Is this lady at any risk during pregnancy? Should be assessed. Any risk during labor, any risk post-delivery. This should be assessed pre-pregnancy ideally. And also lifestyle modification, I think it's very, very important. I think it is important to maintain a balanced diet, exercise, and also manage our stress levels. So lifestyle modifications as necessary should be ideally done before pregnancy, and it matters a lot in the preconceptional period for a healthy pregnancy. So the lady has to be mentally and physically healthy to provide a proper intrauterine atmosphere. Most of these are revolving around an optimal intrauterine atmosphere. So it's important that the lady provides it. And as caregivers, we should make sure that our ladies come for pre-pregnancy counseling. I know it might be slightly a far-fetched idea because antenatal care itself is suboptimal, and can we expect pre-pregnancy care? But if we are talking about reduction in the cerebral palsy, I think pre-pregnancy care, taking care of their medical problems, what medications they are on, and how to ideally prepare them for pregnancy is very, very important. Smoking, alcohol is again not uncommon in women. I forgot to add that because that also can add on to the prematurity, intrauterine growth restriction, etc., etc. Substance abuse is also becoming common even in Indian women. So I think it's important that we modify their lifestyles before their pregnancy. And during the pregnancy, it's also important to continue the healthy lifestyle. If they have had children with previous cerebral palsy, very important to counsel them, even send them to a geneticist to see whether there is a genetic origin for this, and make sure that they are given optimal care. During the antenatal care, I think it's very important to supplement vitamins, iron and calcium later on, and if they are really malnourished, I think micronutrient supplementation is also important along with iron. Important to have proper scans, especially around 13 weeks and 20 weeks, to look at the structural development and completion, and also to see whether the baby is chromosomally normal, okay, because structural abnormalities can be associated with more incidence of cerebral palsy, greater incidence. So it's important to have scans, and it's unfortunate that all women in India don't get ultrasound scans. Okay, so that is another important thing that we should be looking at. And screening for diabetes, thyroid disorders, etc., and also of course anemia should be taken care of for every pregnant woman. HIV is of course being done as a national policy, which is good. The other thing is important to assess the growth by proper assessment of the symphysiofundal height, what we call as the uterine size, and also if there is a doubt of growth restriction, they should have growth scans, and hopefully the Dopplers that I mentioned for the timing of delivery, etc. I know it calls for a sophisticated care, but if we are talking about prevention, this is the spectrum of things that one could do. Intrapartum care, I think it's important to monitor the fetus. Cardiotocograph, that is the machine that we use, and a sort of ECG-like strip that we take to monitor the baby's heartbeat, I think it should become more widely available unless something else becomes available to detect babies who are of danger, who are rather at risk of suffering hypoxia, that is less oxygenation. One should have proper facilities. There should be a resuscitation corner with all the facilities available to resuscitate the newborn in case the newborn comes out flat or with less upgars. Wherever there is a chance of prematurity, one should be well versed with the protocols of using antibiotics if required, antenatal steroids, and also magnesium sulfate prophylaxis. All these might reduce the cerebral palsy incidence in our country. Cooling is another aspect that the neonatologist might be able to share with you. It's important if the baby has suffered hypoxia, that is oxygen deprivation, especially during labor, then it's important that the brain cooling is done by the neonatologists, and facilities and awareness should spread among people.